Hey guys, Dr. Frank here with Northtown Chiropractic and Injury Rehab. I just wanted to make a quick video for you breaking down headaches. Now, this video is going to apply to people suffering from both tension headaches or migraines. And we'll explain a little bit of why it applies to both parties at the end of this video, okay? So I'm going to explain to you what type of providers you can seek for headache management and the most likely outcome to seeking each of those providers out for care. So if you seek a traditional chiropractor, chances are you're going to receive traditional chiropractic manipulative therapy. This is what most people think of when they think of crack your back, crack your neck. For some, this works wonders. For some people, though, they're uncomfortable with this therapy or their treatment, quite frankly, requires more. For a lot of individuals, they'll start with their primary care physician. This will most likely result in over the counter pain medication, prescription medication, or a referral to a neurologist for further workup. Something to keep in mind if you find that you are one of those who are taking over the counter pain medication daily to manage tension headaches and migraines, this probably is not a great thing to do. Over time, eventually, your liver and your kidneys are going to pay the consequences. And the GI system, too. It can't handle all those over the counter pain meds on a consistent basis. Physical therapy. This is great when it comes to exercise rehab, especially if the root cause of your headaches lies within a cervical spine dysfunction, so a problem in the neck. You could start with a neurologist as well. Many people do start there. If you're an adult, this is your first onset of headaches. It's something that you've never experienced before. It's the worst headache you've ever had in your life. You're going to want to start with a neurologist. They usually order imaging. Once they determine that the headache is relatively benign in nature, they're usually going to prescribe a medication, either over the counter or prescription, and they may refer you into injections, so trigger point injections, Botox therapy injections. Of course, my favorite place to start with Northtown Chiropractic and Injury Rehab. Instead of bouncing around and just getting maybe an over the counter medication or just getting an injection or maybe a few exercises, I encourage our patients or people suffering from headaches or migraines to start with us. And this is why. Not only are we going to go through a detailed examination, an extremely detailed history with you, but we're also going to take the time to palpate the muscles in the back of your neck. When's the last time you saw traditional care and they've actually taken the time to look at the musculature in the back of your neck? I have not met anyone who suffers from migraines or tension headaches who has not had some degree of cervical muscle dysfunction. So, knots, trigger points, muscle adhesions in the back of their neck. Common factors that can attribute to headache and migraine pain. So at Northtown Chiropractic and Injury Rehab, yes, of course, we provide chiropractic manipulations, cervical spine manipulations. Again, for some, this is great. For others, this therapy may not be indicated. We also offer low-level laser therapy, cold laser therapy. This is a very conservative treatment where we shine a low-level laser light on the muscles on the back and the neck to reduce inflammation and increase blood flow. We offer instrument-assisted soft tissue technique. Imagine deep tissue massage on steroids. This works wonders and usually has immediate results for our patients. This is an excellent alternative to going to get those Botox injections. I cannot tell you the number of people who we've been able to successfully get off of trigger point injections just by providing these therapies. We follow up with some traction. A lot of people do have disc problems in their neck, disc herniations, disc bulges. This can put pressure on the nerves, resulting in headache pain or migraines in many cases. Some simple traction combined with cold laser therapy, combined with instrument-assisted soft tissue technique, if indicated, combined with chiropractic manipulative therapy, goes a long way. We usually see much longer lasting relief with our patients. Our goal for our headache patients is to see you no more than once every 4 to 8 weeks. That's dramatically different than how a lot of other physicians practice who are in the field of musculoskeletal health. We want you to be feeling good as much as we love seeing our patients. We want you to be outside enjoying the things that you do headache free. On top of that, all those treatments that we offer, and that's in one visit. On top of that, we can offer you guidance on supplementation. Have you ever heard of OPC3s, CBD oil, magnesium? There's so many different combinations we can make up for you to try and help. Nutrition, yes, we'll discuss that with you. Referrals, if you need to go see a neurologist, if we feel something's not right, we're not going to string you along. We're going to get you into a neurologist right away. And of course, lab work. A lot of people don't know this. A lot of times, headaches might be the underlying sign or symptom of something more serious going on. At Northtown Chiropractic and Injury Rehab, we can actually order you the blood work that you may need to follow up and make sure that we're not worried about some other underlying pathology. I hope this helps. I hope this gives you a good idea of, depending on what provider you start with, the most likely outcome to your therapy. Of course, I would encourage you, start with us. We can take care of everything. Remember, for a pain-free tomorrow, call Northtown Chiropractic and Injury Rehab today. I can't wait to see you soon.